So we see in the cardiovascular system, we have an electrical conduction system. Again, just to review, the SA node is the pacemaker site. It will send a signal, electronic signal, through the intra-atrial pathways. This signal is held up here at the AV node for milliseconds to allow the atria to empty its blood volume into the ventricles. It continues back down then through this bundle of His, through the right and left bundle branches, and then this electrical impulse continues throughout the ventricles and the Purkinje fibers. So I'll just reproduce this type of drawing here of the electrical conduction system. And for simplicity, I'm just going to give you a left bundle branch and a right bundle branch. And we can name this the SA, AV, the His. All right. So as far as the electrical conduction system, the general pacemaker site is the SA node. SA node likes to fire somewhere between 60 and 100. The next pacemaker site is at the junctional site near the AV node, and this likes to fire at about 40 to 60. And then somewhere down here in the ventricles, they will fire somewhere just about at 40 and less. But we can tell by the number system here that as we go down through these backup pacemaker sites, they're not the primary pacemaker site, they're a secondary or backup. These backup systems nowhere gets near the type of heart rate that we need to sustain your cardiac output. But should the SA node fail, we do have a secondary pacemaker site here at the AV node, and this is the junctional pacemaker site. Now we mentioned the SA node. SA node can fire much less than the 60 to 100. So if it beats less than 60, let's use the number 58. Heart rate being fired from the SA node at 58 is called a bradycardia. And because it's coming from the SA node, we call this bradycardia a sinus bradycardia. If at the SA node it fires at a rate of 60 to 100, we call this just normal sinus rhythm. A sinus rhythm. And now if the SA node fires, when it causes the heart rate to go above 100, this is what we would call tachycardia. And we'd call this sinus tachycardia. Now we can use these rules here as far as rate goes. Anything less than 60 is bradycardia. Anything within 60 to 100 is a normal type of rhythm. And then anything faster than 100 we would consider tachycardia. Tachycardia. Remember, the primary pacemaker site is the SA node. And what these rhythms look like when they're produced from the SA node, it causes the stimulation of the SA node. This firing goes through intra-atrial pathways, which gives us a formation of the first wave, which is a usually upright, somewhat round picture that we can see on an electrocardiogram. This is called the P wave. So this first firing is called the P wave. As this slows down and is just held back for a millisecond, this impulse then dies back down. And I'm going to extend this out so that we can dramatically see that pause. That pause again allows for the atria to eject this blood down into the ventricles. This is called the PR interval, because right here we have the P wave, and the next wave we're going to be talking about is the our Qrs complex. So this is our PR interval. So this is the pause at the AV node. We'll now have what's the ventricles will now accept the electrical stimulus out through the bundle of His and the right and left bundle branches out through the Purkinje system. This will cause our QRS pattern. QRS pattern. Now I don't want to lose you here, but this QRS pattern, basically the first negative deflection, this is our baseline here. The negative deflection here, the first negative deflection would be a Q. The positive deflection above this baseline, positive deflection would be an R. And then the negative deflection below baseline again would be an S wave. This is the QRS complex, QRS. Qrs complex. This signifies that the ventricles have fired, and as a result of the electrical conduction causing this firing, we should have a mechanical contraction, meaning that we should be able to feel the pulse can be carotid here, radial here, brachial, femoral, and the like. So this is telling us that the ventricles have contracted as the impulse has gone through there, which means now we should be able to feel a pulse when we see a Qrs complex. As a result of all of this firing of electrical impulses, now all depolarized, we have to repolarize everything and put things back to normal, which will give us this resetting, an upright, usually round T wave. T wave. So again, a normal rhythm that originates in the sinus node, SA node, when it originates at the SA node and fires through, will give you a T wave, usually upright. There is an interval where that pauses as a result of the AV node. So we have a P wave. We have this PR interval. Then we have the next, which would be the QRS complex, which is that again the negative deflection here, a positive deflection here, and a negative deflection here, giving us the Q, giving us an R, giving us an S, and there we have Qrs complex. This is the electrical conduction system depolarizing through the myocardium. In the end, everything has to be reset, and it goes through repolarization phase, where everything gets put back into its normal position, ready for another contraction and impulse to occur. This is called the T wave. Where we should feel a pulse should be only here at the Qrs complex, as this is the ejection of the ventricles. We normally don't feel the atria contract as they just empty into the ventricles. When the ventricles fire, we should feel a pulse, and this will allow everything else to repolarize in our T wave. So classic EKG interpretation now for any sinus rhythm will always give you a P, usually upright, and before the QRS, there should be an interval where there's a slight pause so that we can have this QRS firing, and we have a T wave. So you should have a P, PR interval, QRS, and a T wave for a sinus rhythm.